Hello everyone, I am Anurag Dottajodre and I thank you all for joining me today. In this project, as you can see, Global COVID-19 Analysis and Policy Impact Study. In this project, I'll walk you through a data-driven exploration of COVID-19 pandemic and how it unfolded across globe and what the number tells us. As we know, it's if not the most well-documented pandemic in the world. And So we'll look at it, what the data means and what the data tells us so that we can prepare better if such pandemic were to happen. And we'll also look at how various government policies influenced the outcomes and what we can learn from it all. Now, moving on. In this project, the goal is to analyze the COVID-19 trends, uncover correlations, and evaluate the effectiveness of national policies. Now, the tools used are Jupyter Lab, Pandas, Matplotlib, Seaborn, and PowerPoint. The data source is our World in Data. It's an open source COVID-19 dataset. We also use the World Bank data to classify countries on the economical level, which we'll look at later in the later slides. And let's move on. As we mentioned earlier, the source of the data is our World in Data dataset. It's an open source data, and the World Bank data, which I forgot to mention in this presentation. Now it covers 150 plus countries with lots of important matrices like daily new cases, deaths per million, reproduction rate, government policy stringency, vaccination progress, and so on. Now, moving on to the methodology of the project, we started off by cleaning the data, and I had to clean the data very thoroughly and carefully since there was a lot of missing entries for a lot of countries, and the data was missing in a way that made the entire data set kind of skewed, so I had to clean it very carefully. And the next we looked at the exploratory analysis or the descriptive analysis of the part, and we explored the data and the trends of infection, mortality, R rate, and other things. We'll dive deeper into that in later slides. And then we moved on to the correlational analysis, and then policy impact analysis, and finally the ranking of government intervention and how effective they were. And then we listed the top 5 insights that we generated from this project, and then we discuss the limitations and the next future plans, next steps, and recommendations with conclusion. Now let's get into the actual analysis. The first plot of the graph of exploratory analysis, the global infection trend. Now as you can see right over here, so what you're seeing here, by the way, I should mention the data first. So the matrices. So on the x-axis you see date, and on the y-axis you see the infection per million. Now why we use the 7-day average data? It's because we wanted to reduce the noise by not using the day-to-day data, because there are reporting, under-reporting, and there's a cluster of reporting, creates a lot of noise. So we use the 7-day rolling average, and we use infections per million because since it's a global trend, we didn't want to skew the data. We didn't want to skew the data by using the actual number, because population is a very important metrics here. We didn't want to use the actual number of people infected, so use the infection per million to normalize the data, so that the population doesn't skew the data. And then so what you're seeing here is so we see on the early on there is a infection spike right after the pandemic declaration and the first lockdown, and then it increases after the Delta wave declared in India, which was the September October in 2020. And then following that there was another spike, quite big spike, Delta wave, and it was actually quite fatal the Delta wave was quite well, even though seemingly the Omicron wave had much more infection, but the death was much more during the Delta wave. Now, this chart, it's very important because it sets the foundation of the entire analysis project, as we will observe and realize as we move on through the project. Now, moving on, next is the global infection trend key findings. So we found that COVID-19 infections rose steadily through 2020 and 2021 with several moderate surges before major variant waves. And Delta wave caused a noticeable spike, but the Omicron wave in early 2020 led to the highest global infection, as we can see in the background right here. The Omicron's highest transmission rate resulted in a record case number despite existing vaccination efforts. The vaccination started before the Omicron, but still Omicron wave caused the highest number of infection. After mid-2022, infection rates began declining with smaller and less severe resurgence because there was vaccination and people with prior immunity. As we see that after 2023 onward, global infection levels remain constantly low, indicating improved virus control and population immunity. Now let's move on to the global death trend. As we can see, and as I mentioned earlier, even though Omicron had really high infection rate, the Delta wave was much more lethal because, as we see, the number of infection for Delta wave was much lower than Omicron, but the deaths were similar, and we will double down on that on our next plot, where we will compare the case fatality rate for both of these waves. Now, there's a very clear picture here. While the cases spiked during both Delta and Omicron waves, deaths were significantly higher during Delta, particularly in under-vaccinated regions. On the contrary, during the Omicron wave, despite record-breaking infections, mortality was far lower, largely thanks to the immunity from vaccinations and prior infections. The separation of case and death trend is one of the strongest signals of policy and healthcare impact. Now, if we move on, we'll see the key findings here. The key findings is death peaked multiple times with major surges in 2020 and 2021 and early 2022. Delta wave caused the highest mortality spike globally. The Omicron wave was highly transmissible but less deadly. Vaccination rollout contributed to the gradual decline in deaths. By 2023 onward, mortality rates steadily declined, showing improved pandemic control. Now, as I said, there will be a CFR comparison. CFR is case fatality rate, which we can see. This is the case fatality rate for Delta waves, and this is the case fatality rate for Omicron wave. And we can clearly see that the case fatality rate for Delta wave was 1.32%. The case fatality rate for Omicron was 0.29%. Now, which is like 78.3% lower than Delta. So what does that tell us? So it's points finger to a few things: increased vaccination coverage, prior infection-driven immunity, improved clinical management, potentially inherent pathological difference between the Delta and Omicron variant, meaning the Omicron variant was weaker than Delta in effectiveness. Now, we will reconfirm that when we look at the global R rate, the reproduction rate trend. Now, an R rate above 1 means the virus is spreading. Now, as we can see that this is the R rate 1 threshold. It means if the R rate is below that, it's contracting. If it's above that, over here, then it's spreading. Over here, it's contracting. Now, we can clearly see that the initial spike is in early 2020, very high because the pandemic just started, and right after the pandemic declaration, it falls down because of the mask mandate and all the government interventions, indicating rapid. Now, as we move forward, um, during the Delta and Omicron waves, we see a brief surge above the R1 threshold, indicating rapid transmission. But notice how the spikes become shorter and less severe over time. which also likely reflecting the increased immunity, vaccination, and public health concerns. Now, if we move forward, we see the key findings here. As we mentioned earlier, Delta Omicron wave spike pushed the R above 1 again, but the average reproduction rate remained relatively contained in 2022, indicating increased immunity and policy impact. Now, if we move forward, there is a country-specific multi-line infection comparison. Now, what is it? Here we compare the infection trend of 4 countries, right? There is India, there is the United States, Australia, and the United Kingdom, all normalized by the population by using per million values instead of the actual number. Now we can immediately notice how the timing and the intensity of waves varied dramatically. The Delta wave, which emerged in India in early 2021, you can see here, there is a slight peak for India here, shows a visible surge for India, while the Omicron wave at the end of 2021 led to a very sharp spike for all countries, right here, and also over here. Now, Australia's peaks are later but significantly higher during the Omicron, indicating a shift in transmission patterns after initial success in suppressing the pandemic. Now, we will actually dive much deeper into that later in the slides, where we compare Australia and Sweden for case studies. There is a note to be made here. Now, as you can see, India's spikes is much lower compared to other countries. Now, not because India didn't have infections as much as those countries, it's just there is a population normalization going on here. India has a very massive population. Due to that, the normalization kicks in and makes it appear much lower than it is. Even though if you look at actual numbers, the number was much more than other countries, Australia, UK, and US. India, so these patterns help set the stage for deeper questions. Why were some countries hit harder or later, and how did policy responses and public behavior influence these waves? And we will answer both of these questions later in the analysis. Now, what are the key findings here? The key findings is, as seen in the chart of previous slide, the pandemic affected each country very differently, not just in terms of timing, but also in intensity and wave patterns. Now, the note, as we mentioned earlier, India's seemingly flat infection curve is a result of population normalization. This chart shows indications per million people infections, which makes countries with larger population appear less severe in relative terms, even though India's infection and death count was devastating in terms of actual counts. Now let's move on to the correlational analysis. The correlational analysis, we're using the lagged correlation with a 14 days delay. This is the lag, the 14 days lag. Stringency index versus new cases in India. Now, this green line that you see, this is the stringency index, and the red line that you see, this is the new cases. Now, what we find here is quite interesting. The green line represents stringency. Now, what's striking is the timing here, because we used a lagged correlation. Now, I want to talk about something else first before we discuss the plot. Some of you might ask why I used a lagged correlation, lagged line plot instead of a scatter plot for correlation, as conventional correlation plot goes. Now, a scatter plot usually determines the correlation between two matrices rather than a cause-effect analysis. Now, I wanted a cause-effect analysis where we can draw actual conclusions instead of just indicating at correlations between two matrices. Here, I use lag correlation with a 14 days delay. Why 14 days? Because 14 days is a very unique and important metric here. 14 days is also the incubation period for the virus, and 14 days is mostly what it took for the policies to take effect and see the reflect in the actual numbers of cases. Now, as we can see, The major increment in the stringency were reflected and followed by decline in the number of cases. And as the policy's stringency got lower, the cases rise, and as the cases rise, it follows a very similar pattern where the stringency is risen again by the government, and again it follows by the decline in case. Now, this is quite evident during both Delta and the Omicron waves. This is the Delta wave and this is the Omicron wave. It's quite evident in both cases. Um, so, now that has been established, let's answer the question why I chose India for this particular analysis. Now, India serves as a very strong example here because of its large population. It was very centralized policy. It had a very centralized policy, and the waves and the numbers, they were very well documented in India, in the cases of India. So that makes India a very strong, if not the most perfect candidate for this kind of analysis. So this kind of a lagged analysis helps us understand not just what policies were applied, but how long they took to take effect. That's a very critical factor for pandemic response analysis. So I thought. Now, what are the key findings here? The key findings is that we observe a consistent pattern here. A sharp increase in stringency resulting in noticeable drops in new cases within approximately 2 weeks. This supports the hypothesis that government interventions such as lockdown, mask mandate, and gathering restrictions had a measurable and timely impact on controlling infection spread. Now, on the contrary, periods of relaxed policy measures often correlated with spikes in infection. This lag correlation plot demonstrates that timing matters and that policy can be an effective weapon against the infection, especially when enforced proactively and during periods of high transmission. Now, as I talked earlier about scatter plot for correlation, this is what I'm using here. This is an overall correlation, it's a global correlation, not for a specific country, and we're using new cases for the y-axis and stringency for x-axis. Now, this is a very interesting plot because as we can see, there is no strong linear correlation here, but we can still spot several key patterns here. A very dense cluster of high infection count is observed around moderate stringency levels, which is 40 to 60 right here. We can see a very large cluster of high infections. Now, this, why might it have happened? So this might have happened because partial loosening of government restrictions, such as letting loose lockdowns and the mask mandates and gathering restrictions in the time of high transmission, may have increased the transmission of fraud, as we saw in the lagged line plot. And we can also see that lower case density appear at the high stringency level, above 70. Above 70, there is a very low cluster, indicating that more aggressive policy responses were potentially more effective. Also, there's an absence of strong downward trend, also hints at the complexity of pandemic control, that factors like policy timing, population behavior, how the population behaved according to the policies, and testing and reporting practices influence outcomes. Now, let's move on to the next chart, where we see the vaccination versus mortality with an income group disparity. Now, this is the point where I use World Bank data to classify countries in 4 parts. Whereas in lower income countries, there's a high income country, there's an upper middle income country, and there's a lower middle income country, as we can see here in the legends. Now, on the x-axis, we use people fully vaccinated per 100. On the y-axis, we use total death per million. Again, this is a normalized value. So what do we see here? We see that high income countries achieved higher vaccination coverage. As we can see, the green cluster here. But still, they faced substantially high mortality. Now, this might have happened because of early waves or older population, as we know that high income countries mostly has a very high older population. Now, upper middle income countries show wide variation, both vaccination and death rate. Now, that reflects the diverse policy responses and healthcare capacities. The low income countries appear clustered with both low vaccination and reported deaths. However, this may reflect underreporting or data limitations rather than actual outcomes, so it's hard to draw any conclusion from that. Now, overall, there is a general downward trend, so which shows that a higher vaccination trend did correlate with lower death rates, just not as strongly as we had hoped for. Now, if we move next, there's another lagged correlation: vaccination versus mortality. Now, when it comes to vaccination, in my opinion, there's a very important question, which is, does the um, increment in vaccination actually result in the declining of death? And that's what is answered here. As we see that during the Delta waves, which is May to July of 2021, deaths peaked sharply before vaccination coverage had substantially risen. Over here, Delta wave. Before the vaccination started, it was a very high death toll. And as vaccination became more normalized among the population, the spikes reduced significantly, and it eventually became flattened as vaccination effort accelerated after the mid summer of 2021. Now, despite the massive Omicron wave, the death toll remained very low, as we saw earlier. The case fatality rate was 0.29% for Omicron. So, vaccination may have had a very strong role in that. That's a very important conclusion that we can draw from this chart. Now, the key findings here, just as we mentioned, the deaths peaked sharply before vaccination coverage had substantially risen. Vaccination effort accelerated, which sustained a very strong decline in death rates. And despite massive Omicron infection wave, the death toll remained relatively low, highlighting the decoupling effect of widespread vaccination. Now let's move on to the policy impact study. Now, in the policy impact study, we're going to do two kind of study. One is a case study analysis, where we compare Australia versus Sweden on their government interventions and key COVID-19 matrices. There's R rate, infection dates, stringency index. We're going to look at it. Now, let's move to the case study first. Now, as we see here, Australia versus Sweden, we use new cases for the y-axis, and for x-axis we use date. Now, in Australia, now why I chose Australia versus Sweden here is because these two countries had a very contrasting response to the pandemic. Because Australia, as we know, had a very stringent policy, while Sweden um, had a very controversial policy where instead of a nationwide lockdown, they resorted to very relaxed option where they have recommendations, and um, they had public services. It was not a strict measure at all. So with that being said, we can see that Australia implemented strict and prolonged lockdowns, which actually resulted in a very flat infection curve in the beginning of the pandemic. As you can see, there is not much going on here because Australia had a very high stringent policy maintained throughout the beginning of the pandemic. Though during the first quarter of the 2022, which was the Omicron wave, Australia did get a lot of infection regardless of having high stringency, though we can see that during the Omicron wave the stringency was particularly low, so that might have strengthened our insight that we generated earlier, that high stringent policy actually reflected in lower case rates, lower infection rate. Now when we come to Sweden on the other hand had a very relaxed approach, as we mentioned earlier, maintained a relatively low stringency throughout the pandemic with recommendations and volunteering services instead of a strict nationwide lockdown. Now, this resulted in earlier and more sustained wave. As we can see here, it had a very sustained early wave, which Australia didn't. Now, that is a very direct reflection of low stringency. Now, this visually contrasting chart suggests that stringency policies may delay or dampen infection surges. It definitely does, but it doesn't prevent it entirely. So, that we can see in both cases. The most highly transmissible variant, Omicron, actually sustained in both countries. Now, look at the key findings. Just as we mentioned, Australia implemented strict and prolonged lockdowns, which reflected by high stringency levels and actually followed by very flat curve early on the pandemic. While Sweden had a very relaxed approach with like recommendation and volunteering services instead of a lockdown or mask mandate, which resulted earlier and more sustained waves of infection. Now, the visually contrasting chart suggests that stringency policies dampen the infection, but it doesn't um, prevent it entirely. The highly transmissible variants, Omicron, cause significant wave in both countries. Now, if we look at the key COVID-19 matrices, it's going to be more clear for us. As we see in the metrics, the average stringency index for Australia was 47.54, which is much higher than 36.96 for Sweden. And as a result, the total death per million for Australia is much lower than Sweden, which is a very strong correlation in my opinion. Even though the vaccination rate was a bit similar in both cases, 82% and 72%, Australia had a high vaccination rate, which might have also had its part in the lower death rate. And when it comes to GDP per capita, Australia's GDP is 51,090, while Sweden's was 55,090 USD and 359 USD. Now, the table summarizes four key indicators that help to understand the context of pandemic response and outcome for Australia and Sweden. Now, in terms of economic capacity, the higher GDP may have resulted in better resilience in public healthcare, but still the death rate was much higher in Australia and Sweden. Now, if we move on to the policy effectiveness study, we see that these are the 5 countries with the least stringency index, and these are the 5 countries with the highest stringency index. Now, what do we observe here? That some of the strictest countries like China and Myanmar, they had a very low death rate, even though for China, it's hard to say because China, as we know, reportedly was not very cooperative with reporting. So there's that. However, countries with like Honduras and Azerbaijan, they sustained really high death rate, even though they had really high stringency index. So that further suggests that the policy timing, policy compliance, and healthcare capacity has a major role to play, other than the stringency and vaccination alone. Now, when you look at the top 5 countries with the least amount of restrictions, they also have they also seem to have very low death rate. Now, it's very interesting to me, though it likely due to underreporting or data limitations, or maybe they had demographic advantages or lower average age of population, which will have to look further. Now, the key observations are similar as we mentioned. The strict countries China and Myanmar retained relatively low death rate, indicating effective suppression or inconsistent and poor reporting for China, as we mentioned earlier. Now, the takeaway is strictness alone is not enough. Its effectiveness depends on combination of policy timing, execution, public trust, and data transparency. Now, what are the top 5 insights of this entire analysis? Now, what are the first one? The first one is Omicron triggered massive infections but fewer deaths. Despite recording the highest global case spike, the Omicron wave saw a much lower death toll compared to Delta. as we saw. The Delta wave had a CFR of 1.32%, while if I remember correctly, the Omicron had a CFR of 0.29%. So, which highlights the effect of vaccination, prior immunity, and possibly lower variant severity. Now, vaccination correlated with more mortality, as we saw, lag correlation chart India showed that as full vaccination coverage increased, death rates fell sharply, reinforcing the life-saving impact of mass vaccination efforts. And what's the next? We saw the stringency policy is equal to fewer cases. We saw it very clearly that policy stringency increments were consistently followed by a decline in new cases after 14 days, demonstrating the real-world effectiveness of timely interventions. That was the fourth insight that we saw. We saw that pandemic responses of different countries were drastically different. Comparing infection trend in USA, Australia, India, and the United Kingdom, they showed us a wide variation of infection trends, emphasizing that policy response timing and intensity significantly shift outcomes. Was the last insight, that is, strictness doesn't always equals better results. Our policy strictness ranking showed that the countries with high average stringency didn't always bring the best health outcomes. Some low stringent countries reported lower deaths, likely due to underreporting, young populations, or different policy enforcement rules, emphasizing that the complexity behind numbers. Now, moving on, what are the limitations and challenges that we faced? Incomplete data for some countries. As I mentioned in the beginning of this project, some nations lack consistent and comprehensive reporting on cases, deaths, vaccination, or policy responses. Missing data, limited global comparisons, we have skewed certain correlations and rankings. Varying policy enforcement levels. A high stringency doesn't always mean policies were strictly enforced. Compliance varied by country, region, and even population groups may have made the actual impact hard to isolate. Lag between policy announcement and effect. Government measures take time to influence or death trends. Like I said in the lag correlation, why I use day 14 as I mentioned. Hence, determining the optimal lag period of 14 days is based on assumptions, and results may shift if lags vary. Now, the 14-day is not a constant lag. Sometimes it may have varied and skewed the ranking. It's a limitation and challenge that it faced. And finally, a cultural and political factors that is not quantifiable but actually very impactful. Public trust, political will, and cultural attitudes towards masking, distancing, and vaccination affected outcomes. These qualitative factors could have captured data but played a very critical role in real world effectiveness that could not be quantified. Now, what's the future plan? Now, this is a version 1 of this project. I'm planning to make a second version with much more insights. Now, the first thing is to dive deeper into how specific government intervention influence infection and death rates. And what I mean by specific government intervention is government interventions like school closing, mask mandate, economical interventions, vaccination interventions. There are multiple various interventions and policies the governments implemented during COVID. I'd like to look at how each of them affected the pandemic in different ways. That is one of the future plans. Analyze how stringency policies, while effective in reducing transmission, impacted national economies. Now, we all saw that stringent policies did a really good job combating the spread of the virus transmission, but it also affected the economics quite largely. I'd like to take a look at that in the next project. Add quantitative comparison of policy effectiveness, dumbbell plots of cases, deaths, and RX before and after major interventions. That is another of future plans. And build a predictive models to forecast future infections and mortality trends using machine learning techniques. Now, as we all know that COVID-19 cases have started to rise again in India, and it's reached 2000 something as of today. So I'd like to build a machine learning with proper data to predict what sort of infection we might see in future. Now, thank you all for being here and doing this analysis with me. Thank you so much. Now, if you have any questions, please comment your questions. I'd like to read your questions and answer them. Now the Jupyter notebook link is this. I'd love also attach it in the description of the video. Please feel free to go to the Jupyter notebook and check out the analysis codes for yourself. Thank you.